Acetazolamide is used for prophylaxis of acute mountain sickness. Dexamethasone is given in case of high altitude cerebral edema. Nifedipine is useful in preventing high altitude pulmonary edema. Chloasma is pigmentation resulting due to exposure to sunlight. Hydroquinone is preferred for treatment. Menkes disease is due to impaired copper transport from intestinal mucosa to the bloodstream. Spinal cord extends from C1 to lower border of L1. Major function of gluteus medius is abduction and internal rotation. Detachment of myosin head from actin is caused by binding of ATP. Galeazzi fracture is a fracture of middle to distal one-third of radius associated with dislocation or subluxation of distal areolar joint. Diet low in niacin or tryptophan causes primary pellagra. Roux test is done to determine thoracic outlet syndrome. In chronic DIC, FDP and D-dimer are increased. Low platelet, prolonged PT and APTT, and low fibrinogen are characteristic of acute DIC. Effect of potassium ionophore, valinomycin on beta cells of pancreas is decrease in the secretion of insulin. Azithromycin is commonly used for community-acquired pneumonia in OPD. Incineration can be done for cytotoxic drugs, cotton contaminated with blood and human waste, but it is not done for sharp waste. Nail scraping is done for KOH mount, is useful in diagnosis of tinea ungum or onychomycosis. Linoleic acid is essential fatty acid. Under Vision 2020, there are 20 Center of Excellence. Rashtriya Swasthya Bima Yojana provides health insurance services for poor. Nursemaid elbow or pulled elbow occurs in children less than 4 years, usually by a sudden pull on the extended pronated arm. Recurrent anterior dislocation of shoulder is caused by abduction and external rotation. Pain over base of the thumb after taking a catch is because of torn ulnar collateral ligament. In avian of femoral head, internal rotation is possible in extended position of hip, but as soon as hip is flexed to 90 degree, no internal rotation is possible. This is sectoral sign. Gallows traction is used in the management of fracture shaft of femur in infant and children less than 2 years. NAT test is done for Neisseria gonorrhea and Chlamydia trachomatis. Dantrolene is drug of choice in malignant hypothermia.